I think Patricia might have joined the Zoom.
I'll go there, yeah.
Okay, thank you.
I was just read AI in that meeting, so where's Patricia? Oh, Patricia's in the lobby. No.
No.
Okay, adding her in. Hello, hi Patricia.
Hi, Patricia.
Hi, Patricia.
Very late, my
Hello.
computer, my laptop decided to
No worries.
upload to what is that? To reboot.
Okay, so it's
I
8:01.
think it's
Shall
that.
we, admit everyone.
Yeah.
Hello, everyone. Good afternoon. Thanks so much for joining today. Just give it one more minute and then we'll get started.
Just to let everybody know that we're also recording the session, as we've had a few people reach out and say that they can't attend after registering, so hopefully they can watch it back in their own time.
Great. I think we can probably get started. So hi, everyone. Thank you so much for being here today and welcome. Today is a really special day for me at Egality. It's my last event before moving on. So really appreciate everyone who's here today. And we'll just get started on the session. So at Egality, a lot of our work starts with a simple but really important question, which is who is missing from research and why? And when we think about mental health research in particular, that question becomes even more urgent. So we know that mental health conditions affect people across all communities, but not equally and not in the same ways. And when you look at the data, that's really brought into focus. So for example, in England, Black people are around 3.5 times more likely to be detained under the Mental Health Act than white people. So if you think about that in a different way, that's 228 Black people per 100,000 being detained under the Mental Health Act, compared to only 64 white people per 100,000. That's not just a statistic, it reflects real differences in how people experience the system, including trust, access, and outcomes. We also see disparities in outcomes across other communities. So among LGBTQ+ populations, the picture is really stark. Data shows that lesbian, gay, and bi adults have more than double the risk of suicide and self-harm compared to heterosexual adults, with suicide rates more than twice as high. In the trans community, those issues are even worse, with 46% of trans people considering suicide and 71% experiencing anxiety. So when we look at this from an intersectional perspective, so for example, people who are both from underserved ethnic groups and the LGBTQIA+ community, those risks increase even further. For South Asian and Latin American communities, often the issue isn't diagnosis, it's underreporting and underrepresentation. Mental health is still highly stigmatized in a lot of contexts and often framed as something to be dealt with privately, within families, or not spoken about at all. And that can mean that people are less likely to seek support, but also less likely to be visible in research. And across all of these groups, stigma does play a huge role, but not just cultural stigma, there's also a lot of structural stigma. So that's shaped by previous experiences with healthcare systems, racism and discrimination, language barriers, migration status, and whether people feel that research and the people leading it actually reflect them. So that's something we've been thinking about a lot at Egality. And through our work on the Oxford mental health study, we partnered with the study team and community organizations to run sessions exploring the barriers people living with mental health issues from underserved community space when participating in physical activity programs, and what kind of program would they be encouraged to commit to in the long term. And what we heard was not just about access, but about trust and relevance, and about whether people felt seen, understood, and respected. And this led us to ask, sort of, if these barriers exist in something like physical activity programs, how do they show up specifically in mental health research, which is an area that is often more sensitive, more stigmatized, and more complex? I just remembered I forgot to introduce myself. I'm Bia, Project and Partnerships Manager at Egality. And now I will pass over to Bhuvan.
Thanks, Pia. Hi, everybody. I'm Bhuvan, Senior Manager at Egality. But yeah, we wanted to focus on one very specific area, which is, again, a reflection from the project and the study that Pia just spoke about, which is how we improve engagement and recruitment and the participation in mental health research from these underserved communities. It's not just how we sort of reach people, but how do we design research that feels safe for people, relevant for people, and worth taking part in, especially if it's to do with mental health, because that's, that's something that also is quite pervasive in the way it affects people. So moving away from extractive models where people are just sort of participants towards maybe approaches where they're all partners, and sort of having that conversation with community organizations and how these organizations play the facilitator roles with different communities. They're the bridge, they hold the trust, and they also understand the cultural context of the people that we are all trying to reach. So they know how to engage people in ways that are meaningful and appropriate, and whether that could be through language, through relationships, or through just different ways of meeting people where they are. So, of course, different community organizations are already doing the work and supporting people's mental health every day through different health and well-being services that they offer. But they're often limited resources, even though the kind of invaluable insight that they bring can really help shape research and mental health research specifically. So today we really want to learn from four of these community organizations and really listen to the experiences of them and their communities, how they engage people, how do they talk to people about mental health conversations, how are they doing things differently and learning and adapting as they go. Of course, we know that we don't all have answers, and there are questions that we sometimes don't even know what we're unsure about. But what we're trying to present is an open conversation, trying to learn from what the community organizations have to share and what they've done in the past and what they will do in the future. So yeah, I'd really reflect everybody here to reflect on your own work to understand, okay, what the gaps are, who are you reaching through the research that you're doing, and who are you not reaching? What are those gaps of recruitment or engagement and participation? And what would it take for us to really bring everybody into mental health research as partners, not just as sort of one-time participants? So thank you. With that, I will do a quick round of introductions of the panelists. So over to you, Thomas.
Hello, I'm Thomas. I work with Inclusive North. I'm comms and marketing for them. And I've also worked with a bunch of different companies such as Egality and Decipher. So that's working on mental health studies and also MSK study we did recently, which was a workshop for MSK and also different types of arthritis too. That also includes joint pains as well. And we actually learned quite a lot from this, looking at different lack of trust with institutes from what we've gathered from the community. And a lot of the research is being done to the communities and not with them is something else we've realized. And during my time at Inclusive North, we've kind of all established that a lot of the funding is not actually reaching a lot of these grassroots organizations. So a lot of these small organizations, which their primarily focus is for helping people with mental health issues. So that is one of the biggest issues that we've actually come across currently. But yeah, we work with Black and racial and minoritized communities as our primary audience, and a lot of this we've been able to see a lot of lack of representation in services and also research, which we're all going to be talking about today. Talking about different resources that people can use that may not have been too widely known.
Thank you. Thanks, Thomas. Over to you, Dr. Patricia.
Thank you. I'm Patricia Rodriguez Martinez Jones. I'm Director of Heritage and Communications at Isla Wales CIC, which stands for Iberians and Latin Americans in Wales. So far, we have engaged with Egality Health in 2 research exercises, the one on colitis and the other one on Parkinson's disease. We've also have engaged with Swansea Bay University Health Board, who supported a 2-year project on alternative therapies, which included acupuncture, reflexology, Alexander technique, and others, as well as counseling. We also have created some support groups for families, for individuals, for mothers and babies. And we are also partners in a consortium funded by the National Lottery. And this is specifically a project that supports the mental health of young people between the ages of 11 and 25. Some of our members are health professionals, and they are leading on some specific things like, for example, prenatal and postnatal to support our mums and babies. Thank you.
Thank you, Dr. Patricia. Over to you, Gavin.
Hi, I'm Gavin. I work at Trade. We're a small LGBT-led health charity based in Leicester, but working across the East Midlands. Our origin is as a HIV prevention service, but we do a lot more than that. A lot of our work is still around HIV and sexual health more broadly, but we also run a counselling service, and we run a whole range of social and support groups, mainly based here in Leicester. And the origin of our counselling service, more than nearly 20 years ago now, was because we saw the need for a counselling service growing out of some of the sexual health outreach, health promotion work we were doing. So we often see mental health and the rest of our work very closely interlinked. We're also a charity that has historically collaborated with academic and medical researchers quite a lot, and I absolutely see the benefits of that, but also see some of the pitfalls and know when that works and when that doesn't.
Thanks for that, Gavin. Last but definitely not the least, over to you, Kofo.
Thank you, Bovan. Good afternoon, everybody. My name is Kofo, and I work with Race Council Camry as a project officer. I also do community engagement. Part of the major objective of our work is to promote equality, justice, and to eliminate racism and discrimination in Wales. So Race Council Camry started by bringing together other grassroots organizations to have a good representation and to reduce underrepresentation in ethnic minority communities and people across Wales. And we've partnered with several communities, several other ethnic minority, communities and people. So part of the work we do, we have the Chai and Chat. That's a small group that meets with women every Mondays, and then they talk about, real life issues, just share ideas and all of that. We also do the Crossing Borders. That involves children from the ages of 9 to 12, I think. So they meet on Tuesdays and they do like extracurricular activities. They learn things like maths, they do pottery, they do, just English. They just do a lot of different extracurricular activities. And we also do a lot of work promoting anti-racism in Wales. We work with the Welsh government, we work with schools, we also work with other grassroots organizations to promote equality in Wales. And this we do by having several events across Wales, in Swansea, in Cardiff, Newport, Wrexham, and other areas of Wales as well. And in terms of mental health research, we've worked with Egality as well. Since I took over from my colleague Momal, I've been with the Egality team twice that we've done research with our community members. And yes, that's all I'll say for now. Thank you so much.
Thanks so much, Gofo. And yeah, it's been lovely to work with all of you in different projects, and just really explore how research can be made more inclusive and accessible through all the different communities that all of you support. So over to Bia to lead us for the first question.
Thanks, Bhuvan. So I'll just ask the first question and then copy it in the chat as well, so you have it as a visual reference. And I'll just wait for anyone to volunteer, but if not, I can pick on you. So what barriers or challenges have you faced when trying to recruit or engage people from your communities in mental health research? If anyone wants to sort of jump in.
Okay.
Thanks, Coco.
So, so speaking from lived experience of the communities we serve at Race Council Career, I've just taken some notes so I don't go all over the place. So what we found is that a lot of our community members, and I think Bia, you mentioned most of these things when you were introducing, a lot of our community members, don't just simply have trust in the system, and many of them have that fear of maybe being reported, when they talk about things that cause them, mental health issues. So for example, I'll just give lived experience of, say, someone from Nigeria, as compared to Wales. So in Wales, we don't spank children, right? And then in Nigeria or in like some African countries, they do that in terms of disciplining, the children. So, coming over here, there's a shift and they don't know how to sort of deal with that situation. And, talking about it in terms of like when it affects their mental health, they feel like if they share their lived experiences, what would they use my information for? What will they, who is looking at this information? Who am I telling? Do I have trust in the people taking my information? Will I get reported? Will I be labeled? Will there be stigma, after this research and all of that? So they don't just trust that and they want to keep things to themselves. It takes a lot of convincing that, this is how this research is going to benefit you, your children, your generation in the long run, but then, there's still a lot of work that needs to be done on that. So that's a major one, that trust, and then the fear that they have in terms of stigma, in terms of, being reported and all of that. And some of these community members as well, they want straight results. They feel like, we just talk and then nothing happens. They want you to give them a deadline. I'm giving my voice for this thing. This is how it affects me. I have lived experience on this. Tell me, what are you going to do right now? Don't just talk to me and don't come back to me. Don't just talk to me, hear my voice, and then I hear nothing back. If someone else comes for another research or a mental health research, they might not want to say anything because they feel like, we've done this severally, we don't hear back, nothing happens, it's not going anywhere. don't mind them. So that's another major issue. Another one I would like to speak about before I shut up now and let other people talk is that many people want to deal with, you know, mental health issues themselves. Some of them don't even realize, you know, they're keeping this burden on themselves because of the realities they are used to. You know, like the men are told, you have to be the provider, you have to be the leader. You know, oh, mental health, what is mental health? You don't, there's nothing like that, you know. You just have to keep going, you have to keep going, you have to be strong, you know, that kind of thing. And then people are just dying inside and they're not able to speak up. If they speak up, they're seen as weak. You know, they're seen as, oh, what are you doing that for? Nothing is going to happen anyway. No one is coming to help you. So you just have to chin up, you know. So those are some of the issues I would just share, you know, from people's lived experiences. Thank you.
Thank you so much, Kofo. Before I move on to anyone else, Denise, did you have a comment you wanted to add?
So yes, hi. Sorry I'm late, Marty. I'm very, very sorry. I had another meeting that overran. So I just wanted to echo what was said previously, and I can identify with a lot of that. The point I was going to raise has more or less been said, which is that a lot of times the only time that individuals in, for example, my community that I can speak about, will engage with the services is at the point of crisis. So there's no kind of interim interventions or implemented to safeguard against major crisis. Sometimes families may identify that something's going wrong in the family, but are too embarrassed about and trying to keep it behind closed doors and try and deal with it internally. But it's when it spills out into the community and there's something awful that happens, that's the only time that oftentimes these services come in. So in terms of engaging with communities and getting them, from my community perspective, again, it's a trust thing. It's the stigma, it's the embarrassment around the fact that this is happening. And it'd be nice to see more interventions in place and ways of normalizing. I know lots of work's been done to try and normalize conversations that will lead to less crisis intervention. So it's a very hard topic, but it's not just about mental health. It's with any kind of research. You say the word research and they feel that there's an ulterior motive, and that what's actually being presented isn't actually what they're trying to get out of the data. So it's a way to get the messaging across and get people in the various communities, get people to come forward who've built trust in the communities to be able to go with the messaging around the research to those communities, where there's integrity and respect built into that relationship. So it's hard to kind of come with a new face into communities, trying to establish outcomes. It's not necessarily readily welcomed in the communities. And I think messaging is very important, and also admission of where it may have gone wrong in the past with research, and where, you know, say, for example, the Tuskegee experiment. So with the COVID, we had a big issue with people uptaking the vaccine because they didn't believe it. And that COVID helped people to understand a lot better about why certain communities just hesitate to get involved. And I think sometimes the findings are in past events like the COVID. So perhaps go back and look at some of the findings from why communities were hesitant to take up the opportunity. So it's not just from a mental health perspective, but going back to the whys will help to understand how then to build stronger connections and more trust to be able to move forward with the research.
I think some of those points that Denise has just made connect with something I was about to say, which was, I think, noticing when we recruit people, who we recruit and when we recruit people for research projects. I think there's a pattern in that people who engage with our services where they are more part of a group, people who are part of our social and support groups, or people who are part of our volunteer cohort and therefore more actively involved with us as a charity, as opposed to simply using services, accessing services as an individual, I think are more likely to engage with requests for research participation. So I think there is very much something there about how trust is built up within organizations in the first place before we even then engage with external research partners.
Thank you, Gavin. Yes, I think a lot of these comments already talk about issues of trust and stigma, engagement and accountability. Thomas and Patricia, do you have anything to add to that in terms of barriers and challenges?
Yes, go ahead. Yes, in our community, of course, one is an obvious one, but it is a language barrier. And there is lack of translation of relevant materials and documents into Spanish and Portuguese, which are the two languages that our members speak. There is also lack of knowledge on the actual UK health system, and so they find it difficult to understand the equivalence and so on. Lack of confidence because they come from obviously different cultures, and that is cultural differences, which a lot of the time can lead to misunderstandings and lack of trust and lack of engagement. Also some practical logistical issues, like for example, things like childcare, the timing of the meetings, and so, for example, people would need, if it's a face-to-face, they would need transport refund and so on. The main issue is that we are not recognized as a community. There are no statistics about Latin Americans in any health records. And so we are always classified as other, and we are classified like other with many other communities, and that makes us invisible. And of course, then our voice is not heard.
Thanks so much, Patricia. I definitely engage with that as a Latin American in the UK. I can definitely relate to it, always sort of ticking other in forms, and that sort of makes you feel like the system's not designed for you. So that's a really important point as well, specific to the Latin American community and a lot of other underserved communities in the UK. Passing over to you, Thomas.
Yeah, it's a lot of similar things because of the amount of like different communities that we focus on as well. So it's a lot of like stigma around this, with like different cultural perceptions. For example, people just saying just deal with it when it comes to mental health and things like, and there's also like a fear of being like judged or like misunderstood when it comes to mental health too. And also with it not like being open, being discussed openly as well. I feel like it needs to be bring more awareness to it as well, in these different cultural in different cultures, with a lot of like lack of representation also, because a lot of people don't see themselves in like researchers and different services. Like it's very hard to with people that have mental health issues, it's very hard to connect with them, which is like the big step going from having the stigma around mental health and then going into trying to get answers for that. And I mean, generally, you need like some kind of incentive to get people to talk about that, which it shouldn't be that way, you know. So unfortunately, it actually is though. But yeah.
Thank you, Thomas. And I think sometimes incentive as well is about sort of recognizing the time that people are giving in their communities, and sort of not being extractive, but it's also obviously not something that's always feasible. So thank you so much, everyone, for answering that question so candidly. I'll now pass over to Bhuvan to ask the next question.
Thanks, Pia. And just reflecting on one of the comments in the chat as well by Betty, that a lot of times people in our communities may not even understand the value of participating in the research. They may just see that as something that just they don't consider, or they just don't resonate with the kind of benefits. And I think it's also really important to actually very specifically spell out and be explicit in why it's really important, why it's important for us as a community, why it's important for our sort of either our future generation or our current services, how sometimes research helps shape future like services and support services within councils or within the NHS, and how much we can get to influence all of it if we sort of actively participate. And like Patricia, like you said, like if we're not invisible in that research, if we're sort of visible and our voice sort of counts and is that's how we can help shape future health research. So I have a few things that everybody spoke about, sort of from dismissiveness, the attitude of sort of asking, which happens a lot with men's mental health in general, sort of dismissal of the concerns or, of any sort of fears around mental health, to, the problem with what the research results are, where is this data going, and, what are you going to do? And I would like to know how, if any of you have any experiences of overcoming any of these specific barriers in the past. So if you've, on a particular study or on a project, if you've sort of, seen a barrier come through and then been able to sort of, devise a different strategy or a different way to like involve people, what could that have been like? Again, floor's open for the panelists to chime in.
Okay, so in relation to our community being invisible, we have got together with the Coalition of Latin Americans in the UK, and there are 10 different organizations, and we have made representations to include the term Latin American in all the official government forms, including the NHS forms. And also recently we participated in a survey in which we completed a report to submit to the Office of National Statistics for inclusion in the new census in 2031. As far as language barriers, we then, for example, translate surveys into Spanish and Portuguese so that our members can answer in any language they like, including English, of course, if they feel confident enough. So we hire qualified translators within our community, and they are sometimes they also produce summaries, for example, to make it more easy to understand. The language of some of the documents can be quite complex, and so we simplify things to make them more accessible. In order to overcome the lack of knowledge of the system, we provide training and sessions in which we actually literally explain the structure of the NHS, for example, so that once they understand it and they understand how to navigate, they feel more confident. We give them reassurance and encouragement by emphasizing the importance of participation. And so sometimes we get together with one-to-one conversations. And also we have the support groups that I mentioned earlier on. And in order to, get them to engage with other communities, we do a lot of projects together with the local community so that they feel more at ease, more integrated, and then therefore more eager to participate and trust other people.
Thank you, Patricia. Would anybody else like to come in?
I think that it's a interesting gap around the scale or the level at which the research is being undertaken and for whom. And I think, I think when we're working with NHS or public health partners locally on kind of service improvement, then there's a really tangible reason why community members might want to get involved. It's an easy sell, and very often it's easier to negotiate those processes of co-production so that people's voices are heard and taken into account, and there's a tangible outcome that can be seen within, as Kofa said, that kind of time scale that makes sense to people. Whereas actually, I think academic health research it's often, the agenda there is very different. The timescales are very different. And I think there's not so much the opportunity for the bottom-up needs of communities to feed into shaping that research agenda, because what feels important and significant on the ground in people's lived interactions with the health service is very often not going to be, what counts as 4-star internationally led research for the research excellence framework and all of those metrics that matter to academic researchers. And we've seen that a little bit with some PhD funding opportunities in the region, which were notionally created to support engagement between academic early career academic researchers and community organisations in the East Midlands. But actually, when you frame a PhD proposal around what matters to a charity like ours, when it goes through a research committee at the university, suddenly it's not cutting edge research enough and therefore is not prioritised for funding. So there's really kind of systemic barriers to community voice being heard in academic research, I think.
Oh, that's really interesting. And absolutely, I think I'm so interested to know more about what the sort of gap is, but I can absolutely foresee that there is the real life gap that you're sort of in touch with, and you're like, okay, this is what organizations like ours need, or this is what communities that we represent need in terms of mental health research, for example. Whereas there's always like fancier interventions that are, more appealing to bigger funding bodies and bigger funding grants and things like that. And how do you sort of overcome that? Because it's almost like that vicious cycle, isn't it? If you don't put money towards it, it's not going to get funded, it's not going to get researched, and that unmet need sort of keeps widening and widening. Whereas other also important research is happening, but it's not specifically research that the community members are particularly saying that they want. So yeah, thank you, Gavin, for that. Anything from Thomas or Kofo?
Yeah, so speaking of like funding, we are currently like working on a project to help these smaller companies apply for funding and making that process a lot simpler, so that different smaller community organizations and grassroots organizations can actually find it easier to apply for these and basically funding these directly as well. I feel like this definitely helps with this whole these whole issues that people have with getting declined for funding and not knowing why as well. So that's a big part of what we're currently doing. For example, even individuals we're helping them to like get into applying for grant funding also, and also additional solutions that we've seen is just like meeting people where they are physically and socially. So that means going to the places that they work at, because our organization works with other organizations, but then we also work with communities as well. So it's a bit of both that we do, and we just need to make sure that's like culturally competent that these approaches are, and also make sure like the organizations that we work with are used as like bridges to build trust with communities also.
Amazing. Thanks, Thomas. Denise, we'll just come to you. We'll let go for what she wanted to add, and then we can come back to you. So go for over to you.
Okay.
Oh, sorry, Dennis. Okay. So what I would just like to add in terms of things we've done to sort of overcome some of the barriers in terms of research is that so one of those things is that we sort of have people that have lived experience and have had I've gotten something beneficial, like maybe their voices have been heard in one way or the other, come to speak with people currently having such fears, I think it's worked in a way that it has helped to build, trust and to build confidence in some way. So one thing we've also done is to like share progress of how something is, how, for example, I'll use the Anti-Racist Wales Action Plan just as an example. When, all these bodies and community representatives, came together to, write this plan, to build it and all of that. There's still a lot of work going on and there's still a lot of progress going on. But like how Black history or other things like that have now been embedded in schools, how people are talking about it, how events are happening, to just promote equality, so just having people that have such lived experience of how something is working, of how a positive effect of research, how is working, just speak to community members. I think that has worked quite well. It has helped to build confidence in some way. And what we do is to continue that process of confidence, of trust building. We meet community members where they are. We sort of we create this close knit, like WhatsApp group where our community members are. We share information from time to time of things that are happening, things they've been involved in, and what progress is happening with such research or with such things that they do. So another thing we do is just have one-on-one conversations. If there's a research about something, maybe the lead or the organization having such research, we invite them, these are our community members. When can you come? Speak with them, look at their faces, talk to them about what this research is going to do for them. And it builds, it sort of builds confidence and it helps them trust then the work that is being undertaken when it comes to research. So that's something I wanted to add.
No, that's great. I really love the sort of showing larger results. It doesn't have to be just the smaller research that's having an impact, but larger plans and sort of changes in curriculum or in, news and information, things like that, which have also been informed by community priorities and community sort of voices. Yeah, Denise, please go on.
Yes, just to address what Gavin was saying initially, and then I'll tell you an example of what we did at the University of Nottingham around the COVID time. So recently I went to something called Local Voices in Research workshop, where they're looking at different community groups and initiatives to be able to improve on the way that research is carried out. And I know that Nottingham Trent University have got a big collab where they do a lot of co-production with communities. So I don't know if you're familiar with that. You're smiling, Gavin. Maybe you know about it. But I hope that's not been a barrier to you.
That might have been the funding stream I wasn't particularly positive about.
I thought I was bringing something new to your understanding, but I'll move on then swiftly. I won't leave that bitter taste in your mouth then. But just to say, when I used to work at University of Nottingham as a senior technical specialist, and during the COVID time, I got very, very concerned about what was happening and all the noise that I was hearing around the COVID and the lack of engagement and the scaremongering and the myths and it was a time of great uncertainty, and it was a time that I kind of use now as a reference point. But what a group of us decided to do, academics, medical students, and myself, we decided to find a way to try and understand what was causing the vaccine hesitancy in the community. So in doing so, we sat down, we had a meeting, planned it all out, and we decided that there's a couple of medical students who are very keen to kind of work in this area, trying to understand how to embed better research and better outcomes for different communities. So what I said to them, what might be a good idea is to put a video together where we all spoke about who we are, our input in it, and explain that we're not tied to Big Pharma. We are genuinely just individuals who are very concerned about the loss of lives and trying to understand how we can safeguard the well-being, and just to understand why they're hesitating to get involved in the vaccine program. And we also offered to go back and bring the reports that once we got all the questionnaire responses and kind of churned out the data, we wanted to go back and sit and have conversations with them face to face. So before I sent the questionnaire out to the various community groups that I was tied to, I made sure that the video was ready so we could send the videos so they could have an understanding. And then we found that the engagement with the uptake of the survey was great. And we got some really good outcomes that was significant enough to be able to then write up the report, and it helped them towards their medical degree, and was able to go back to the community. And then we also use that information to feed back into bigger council groups to say, this is what we found when we did this body of work. So it's not, although it seems in silo, we're able to tie that to other bits of research that was being done across Nottingham. So that's how we found that we got more engagement. It was a far better outcome than I'd expected it to be, based on the distrust that they had. The end.
Thanks so much. Yes. No, thank you. And I think, yeah, there are these sort of just some creative ways that we need to just keep, be like, okay, what is something that you're hearing from the community, and then you sort of like invent a way or like devise something that's a bit more creative to sort of overcome that particular hurdle.
But it's really
Yes, go on,
interesting
Gavin.
because the collaboratory doctoral training centre that Denise mentioned is I think on one level is a really good initiative in the East Midlands. That partnership between the local, I think it's now at least 5, possibly 6 local universities involved, with a specific focus to look at projects at doctoral and pre-doctoral level that are collaborations with community organisations and small businesses. That's a really good idea, but unfortunately some of the participating universities still have to rank and prioritise the projects that they put forward to the doctoral training centre. And at that point, university research strategies kick in as the filtering mechanism, not the needs of the community. So there's a great opportunity there, but a structural barrier to it operating in the way it was intended.
Yeah, I think sort of ideal structures or ideal sort of intentions, and then the sort of reality of how it pans out can be different, definitely. I think we have about 13 minutes left, and if there's any questions in the from anybody else listening in, very happy, very welcome to any questions. But while that's happening, we just wanted to ask all the sort of 4 people here of sort of one sort of thing that you'd tell researchers to do, and one thing you'd tell them not to do. That sort of thing, like a do's and don't. If you could get one from each of you on what researchers should do when they're planning their mental health research, or when they're approaching you and approaching your community and stuff like that. So yeah, the floor is open. And if there's anybody in the audience who's listening and wants to ask a question, please feel free to do that as well.
I would like them to focus some research on the trauma of displacement, because we are supporting about 65% of our members who are asylum seekers and refugees, and they're certainly traumatized by the sheer displacement they have experienced, and the lack of understanding when people talk about them, and the policies that are being implemented, all the changes of legislation that seem to be a bit more aggressive towards them, and making them feel not only that their lives are in limbo, but that they're also almost rejected. They don't feel welcome like they should be. They're human beings that have gone through terrible trauma and terrible experiences, and they should find some tranquility. And they are not finding that, because they are worried about what is going to happen all the time. So that's one thing I would like. Thank you.
Thank you, Patricia. And yeah, fully agree and stand by that. Anybody else? A do or a don't?
Oh.
Go on, Cover.
Okay, so a do for me, I'll say researchers should always be transparent. No cutting corners, or no speaking in I'll say jargon that community or people don't clearly understand, be transparent about what the research is about. Let people then, decide what they want to do about, if they want to participate or not, and all of that. So I think full transparency is really, 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 really important.
Yes, definitely. I think like transparency is where the problem is, isn't it? Like in the past, it hasn't been very transparent, it has been very sort of, best practice. And then that's why we're here, where there is mistrust and, fears and everything. Yeah, go on, Gavin.
Yeah, I think the do that I was going to throw into the mix is build long-term relationships with community organizations. Don't come to us, a couple of weeks before you have to submit a funding application, and hope that we'll sign up. And work with us long term to build that trust, to understand what we do and the communities that we work with, and have those conversations so that what we're seeing on the ground in terms of trends that need some research to address them and to interpret and understand them can feed into those communications and give people time to shape their funding applications in a way that meet the needs of the communities, as well as ticking all of the boxes that they need to prove their academic credibility. So yeah, I'm always more inclined to say yes to working with researchers that we've worked with before, or that we've collaborated with in small ways and we're building incrementally to something bigger, than just to say yes to everything that comes here, or even invest the time that I don't have in trying to work out whether every invitation is worth pursuing or not. A small number of long-term relationships, I think, is far more effective for everyone concerned.
100% agree. I don't think that's, you could have said it better. I could have said it better myself. I think it's so important for these relationships to exist outside of funding, exist outside of programs. It's not just sort of, oh, we have, £5,000 of funding. We want someone to do something for us with that money. That's just not how good mutually beneficial relationships work. And that's not how our communities benefit from the research, because with that sort of continuous work and with the sort of continuous relationship, that's how even the sort of communities will have that presence of either a university researcher, so just hearing about, okay, yeah, we know that, for example, Gavin knows, oh yeah, the University of Leicester, they always have something or the other happening with trade, and they sort of build that trust with them. So yeah, that's super important. Any other things? Yeah, I think Thomas, if you wanted to add something.
Yeah, I was gonna mention. Yeah, sorry. I was gonna mention about the building these long-term relationships too, just like making sure that the organizations actually like connect with everyone involved and like the participants. And also that they shouldn't just treat the communities as like data sources, and making sure that because like engagement only happens after everything's also already been decided. And yeah, I think it's just really important to use this to like build that trust with these communities.
Absolutely. Okay, I think that's all the questions that we had. And just going to pass to Bia. Just also want to just give a quick little shout out to Bia for all her wonderful time at Egality. She's been with us for 3 years, and obviously you might have seen her different projects and things like that. So yeah, we'll definitely miss you a lot. And yeah, so glad we got to do this. Mental health is something that both Bia and I are quite sort of passionate about and keen to sort of keep exploring in different areas and different ways. So yeah, glad we got to do this together, and I'll let her close.
Thanks so much, Bhuvan. Yeah, I think this has been a really special event. Definitely something that's close to both our heart. And Gavin, I don't know if you know, but actually, I think on my first day at Egality, I had a meeting with you. So this is the nice full circle moment. And I've really enjoyed working with all of our community partners. It's been a great 3 years. at Egality, and I'll definitely miss everyone here, and especially our community partners as well, who I enjoy working the most with. So thank you so much, everyone, for making this event special. And before I start crying, I'll just quickly close. So yeah, obviously we've learned some really important things today, and talked about how we can better engage communities in mental health research, talking about trust, accountability, listening, meeting people where they are. And I think these are all really important things for us to take forward. Egality is doing a series of events this year. The next one, I think, is on AI in July. So if you want to sign up, follow us on social media, on LinkedIn and Instagram. Feel free to register for any open events. And thanks again, everyone, for giving the time today. Thank you so much to all of our panelists. It's been a great discussion, and thanks, Govan, for being just the best colleague ever, and for co-hosting this event with me. If we could just get the panelists to stay for a minute or so, so we can take a little screenshot, that would be great. Kofo, did you have anything?
Yes, I just wanted to say something about I put something down about more, research topics that can be done, and I had that thought with me from the last time we had a meeting, and it was about postpartum depression. I know a lot of research is going on that, but I don't know how much work has been put in terms of postpartum depression, especially for well, I'm a new mom myself, not really new. My son is 17 months old, and talking from personal experience, it's been, well, my home country is Nigeria, right? And then in Nigeria we have a whole village, when it comes to taking care of just like one child, talk less of people that have twins or triplets and all of that. And then as the mom, you can just sleep all day while you have everybody taking care of that child for you. But here is just like you, your partner, and that child dealing with work, dealing with taking care of the child, teaching that child. You just have to be there at the same time, doing everything at the same time. So I don't know if that is a topic that Egality you can work with partners or health researchers about, and we can have that. So postpartum depression, and also mental health with older men from ethnic minority communities. That's also something I wanted to talk about, because also from lived experience, they're taught, or they have, the view that, there's nothing like mental health. They just have to go. So postpartum depression, and also mental health when it comes to ethnic minority, older men from ethnic minority communities.
Thank you, Kofa. I think they're both really important points. I know sort of the differences in Brazil to sort of child raising as well, where you really do get a village, and it's that community, and everyone sort of coming together to support. And I think there are a lot of issues around that in the UK, with sort of loneliness and people not feeling supported in that community. So definitely something that's really important. And I think a bit of a culture shock as well for a lot of people from underserved communities when they come to the UK and they don't have that sort of same support system. And again, definitely bringing it back to my community, relate to sort of older men from those underserved communities, and the stigma around talking about mental health, about admitting to having mental health issues or to struggling, which can definitely lead to a lot of long-term, not only mental health issues, but actual health issues as well. So yeah, those are really important points, and definitely something I think we'll keep in mind moving forward at Egality. Did anyone else have any final comments they wanted to make? No. Okay, if we could just keep the panelists so we could do a quick screenshot. Thank you so much, everyone, for joining today, and have a lovely rest of your day and weekend. Gurvan, can you take the screenshot? Because I'm getting funny combination of people on the screen.
Yes, I'm going to just spotlight the two of us as well. So hopefully we
And
can.
Sneha, maybe you could come on.
Yeah,
here.
Sneha, if you'd like to.
If Dr. Patricia is
Sorry.
still here. Dr.
Yeah, I
Patricia.
don't. Yeah.
Yeah, I think we lost her at some point.
I'm not allowed to spotlight anymore. Oh no, I can do
Zoom's
it now.
being weird.
Yes. Yeah. Perfect. Okay. So if everybody wants to smile and stay smiling for a minute. I did one, we'll do one more. Perfect. Thank you all so much. It was a lovely conversation.
Yeah, thank you
Thank you
so
for
much.
hosting us.
Can we get the screenshot, Gurvan?
Absolutely, absolutely. Yes. We'll send it across.
Thank you. Hi, Sneha. Thank you.
Yeah,
Thanks
thanks
so
everyone. It was a
much.
lovely talk. Yeah. And see you later.
Lovely
lovely
to
weekend.
bracket
Yeah.
your working time at Egality, Bia.
Yeah, no, it was great, Gavin. It was such a unexpected coincidence, but yeah, really full circle. Keep in touch. If you don't have me on LinkedIn, add me on LinkedIn. Yeah.
Brilliant.
Thanks
Good
so
luck.
much, everyone. Thank you.
Take
Take
care,
care.
everybody. Have a lovely
Bye-bye.
weekend. Bye-bye.
Thank you, everybody. Bye bye.